Welcome, I'm Keith Tebow. FRC Media is looking back at the impacts of COVID-19 here in Fall River 1 year after it all began. Never before have those in the healthcare field been tested as they have in the past year during the COVID-19 pandemic. In Fall River, the city's Department of Health and Human Services has sort of been the conduit, if you will, between policy and those in healthcare to share information and get people what they need to know about COVID-19. I'm pleased to be joined in this segment by Tess Curran. She's the Director of Health and Human Services here in Fall River. Tess, thank you for joining me. I appreciate it.
Happy to be here.
You have been probably one of the most important and busiest people, I'm sure, throughout the past year. Many people have seen you a lot more in the past 12 months, but may not know about your background. Tell us a little bit about yourself and how you got to be in this role.
Sure. So I've been in this role for over 2 years now, about 2.5 years. I have my master's in public health, and that's kind of, what got me this role. And it's been a great experience here in Fall River. Certainly wasn't anticipating quite the year that we've had. I don't think anybody had, but it's what we do every day in the health department is kind of, this contact tracing and all of the emergency preparedness planning has, in a sense, gotten us prepared in a small way for something like this. So it has been, thread throughout my time here is working on emergency dispensing site plans and public health emergency preparedness. But it has been a long year and a lot of work and undertaking for everybody, not only in my department, but everyone's been challenged this year.
I've done a number of these interviews looking back at the year, and the first question I ask, and I'll ask you this, when did you first hear the words COVID-19? And when you first thought of it, did you ever think that it would get to the point where we are here today? I guess last December when the cases in Wuhan, were happening, and then, January, February when things were happening out west, or maybe even that was late March probably late February, early March, and then within a quick time, all of a sudden, it was shutdown, lockdowns, essential workers, and all of that. And I think, in a sense, a lot of us were hopeful that maybe we could contain this in a sense if certain measures are in place. But we also didn't know, what type of transmission was happening, the primary routes of transmission. So there was just so much that we were learning as we were really in the thick of it all that I don't think anybody could have anticipated us being here today like we are. But, Let me ask you, I've asked everyone this question, and you may actually have a more of a yes than a no. I asked them I just asked the mayor that, there's no playbook on a global pandemic. But as a public health professional, there may have been some sort of training in some way, shape, or form, or information about potentially having some sort of infection. Is that the case? Was there something that you had at least back here that you could have used?
Yeah, I think with contact tracing, we do that all the time in our office. We're lucky here in Fall River to have 2 great public health nurses. We are continuing to do contact tracing for other diseases. So, and that's been throughout this entire pandemic. People are still getting other communicable diseases. So we, know how to do that. We do that regularly. In terms of the emergency preparedness, we had drills and quarterly meetings and monthly meetings with my public health emergency preparedness group from the state, where we, talk about, best practices and tools that you can utilize. So there has been, this is an ongoing kind of education for us in public health. I think what's different here is just the
the capacity was just so great. The case counts were so great for so many months that the system was overwhelmed, and that we, our plans were for a vaccine clinic, that would be a 24-hour bioterrorism operation, not a 6 to 8 month long-term vaccine plan. So the playbook was there, but it's was a much greater capacity, the long-term versus these kind of short-term things that we always knew that this could be occurring, but it didn't quite think that it would be, the duration of it would be as extensive and as long as it has been.
Now, when things started to really ramp up, was the city, in terms of health information and health guidance, getting all its direction from the state? Is that the way it really linearly happens? Federal CDC, states, and Fall River. Is that how it worked?
Yeah, that's how it really works. Is that we get our information. The state takes information from, even with the quarantine. CDC makes recommendations to shorten the quarantine. The state then reviews that. The state then implements that, and then notifies, local health. And we can make things more stringent than the state potentially. Even in terms of things like restaurant closures or things like that as it relates to COVID. Like some communities have put more strong restrictions on businesses, but we can't do anything that is weaker than the state's guidance.
And actually the city had to do that. The city, as you remember, closed down, and then when the summer went along, things got better, things reopened up. This building even reopened up, and then when the surge hit and we got into that red level zone, the city had to scale back when other communities may not have did some of that, correct?
Well, that was actually part of the state guidance.
Correct.
So the state, again, if you were kind of in that red zone, then we were at a lesser phase than the people in the yellow and the green zone. So we were still relying on the state guidelines for when we kind of fell back into that, lesser of a phase in a sense. Yeah.
I want to talk a little bit about collaborations with our local healthcare partners. South Coast Health, Stewart and St. Anne's, Primacare, Health First. I know you're probably in contact with them on a regular basis to begin with. How did that ramp up, and how was that conversation to make sure that all the healthcare partners were on the same page, especially early on when you knew that they would see a lot of cases coming in?
Yeah, so back in the spring of last year, we began to have regular calls with the hospitals and the health centers here in Fall River. Those at the get-go were multiple times a week. I think 3 times a week we would have calls where we just touched base on, PPE, cases, number of ventilators, and all of that. Then as we kind of moved along through the summer months, cases dipped. We actually took a break from those regularly scheduled calls. And then back in the fall, we've ramped those up and now have at least once a week calls with our community health centers and the hospitals. Again, where we discuss how things are going in the hospital, their case counts, and then any other initiatives that they're working on, any testing that they're doing. And we kind of provide the city, the mayor's on the call, I'm on the call, and we provide them with an update about any changes that are happening in the city, any trends that we're seeing, any needs that we have, or just an open forum for collaboration.
Was your role, in a sense, sort of a liaison? Because, the hospitals don't have a call, say, to the state health officials, where you sort of have a more direct line. So were you sort of that, hey, we're hearing that, our hospitals need these questions answered, when you're making calls to the state, and vice versa? There's some things that maybe the state may not directly need to get in touch with the hospitals.
The hospitals do connect with the State Department of Public Health, so does Health First, and so does STAR. So we all kind of have connections with the State Department of Public Health, but they differ. That's more targeted towards the health
centers or the hospitals, and then maybe and I don't know because I'm not on their calls, but our calls with the State Department of Public Health are more policy driven in terms of what phases we're in, what restrictions are going on, what's going to be happening with vaccination efforts and all of that. So I think the hospitals do connect with the state. It's just a different message that they're receiving, at least from what I've gathered. They don't need to know what restaurants have to do per se, like I do.
Getting back to about a year ago when all this was starting, boy, you think about things and you think that some things happened so long ago, but it really wasn't that long ago. You mentioned PPE. That was such a huge issue. The mayor even mentioned that he had some extra PPE in his car and was just sharing it with local hospitals. How big of a deal was that to get the masks and the hand sanitizer and meeting those needs, not only for hospitals but to city departments, which are under your purview, to get that needed material?
Yeah, that was certainly a change, especially it was reserve the masks for people in the hospital, and then kind of early April it came out we should all be wearing our masks, and we should continue to be wearing our masks even today, and even if you're vaccinated you should still wear your mask. So I think getting the message out to just use like a regular surgical mask like this or a cloth mask for your kind of average person who's not in healthcare, and reserve the N95s and KN95s for healthcare workers. But that was a real stretch for hospitals and for community health centers and other healthcare workers to make sure that they had an adequate supply of PPE, because that's really, again, we were learning so much about this as we went, so we didn't quite know, the transmission rates on, how often you can reuse your mask, and then washing them and all of that. So, so the need for PPE was real, at the get-go of this, and fortunately, people seem to have an adequate supply now, and Fall River EMS and all of the city, first responders have an adequate supply on hand. The hospitals indicate that they have an adequate supply on hand. So as more people were manufacturing that, then they were able to have a good reserve on hand.
Was the securing of those materials, did that fall under your purview? I mean, we talk about how I know emergency management was looking for masks. Was it important to have, like, in terms of city departments, to have one central location, maybe your office, to say, okay, what do you need, and maybe your office getting those calls out instead of having 5 calls going to one place? The city of Fall River, again, they're calling us. How come?
Yeah, we really, EMS was trying to get some for EMS, and I don't know, I didn't, they usually handle their own supplies, right, and we handle ours. So we were kind of working independently, but all trying to get any supplies that we could. And then certainly, if we had supplies, we and EMS needed supplies, or our inspectors needed masks or whatever it was, then we'd be able to share that. Whether or not it came through the health department or EMS, we wanted to make sure that the city employees had adequate protection when they needed it.
Another big role of your office tends to be communication, right? Getting people the information they need to make informed decisions. How frustrating was it at the beginning? We've talked about this already, how the unknown about the virus. How difficult was it to make sure you're sharing out accurate information while also not knowing what was going to come down the line?
Yeah, and I think, using trusted sources is really important, and not relying on social media or, your uncle for accurate information. If you were able to get the firsthand, primary sources of information, that's really important. I think that's something that's an ongoing challenge in terms of making sure people have the accurate information so that they can make informed decisions. I think a lot of people get their information on social media, so we really have to continue to try and do that. And you know, things were, like you said, evolving so quickly that, you know, what was accurate last week was maybe a little outdated the next, in terms of, you know, mask wearing and all of that. So you know, making sure that you're encouraging people to go to the website themselves. You know, I tried to, even on the city website, not have like documents. I tried to link to live pages so that, you know, we wouldn't have to always be monitoring it because it was changing so quickly, so that people could just be linked directly to the state website or the CDC website, where they were able to have, you know, a more robust team of people monitoring and updating that information.
1 year ago, we're actually recording this on the day that the city did declare its state of emergency. It was March 16th. And we were here, and I remember, you know, people stepping up to a podium that's nearby here. And exactly 1 year ago, you were eight and a half months pregnant.
Yeah.
And then you gave birth in early April. What was that like for you, if I can ask a personal question, in terms of, there's this virus out there, I'm about to give birth. But what was that like?
I didn't really think of it like that in terms of my health. I think I was just so, you know, we were just working around the clock. So I didn't have time to think about that. I should have planned a little bit better. I didn't have my hospital bag packed when I went into labor, so it was kind of, you know, a little, I should have prepared a little bit more.
Maybe on the way to the hospital, maybe you were like, hey, wait a minute. Was that?
Yeah, I mean, I really, to be honest, was in total denial that I was in labor. I was convinced that it was like, that I just didn't feel well. I thought maybe I had
Braxton Hicks.
Yeah, had something else. So, yeah, my husband was basically like pushing me into the car to get me to go to the hospital, because I went into, this is a lot of personal stuff, but I went into labor on a Friday. That day in my mind was going to be the day that I really started to kind of work on my, like write a bunch of notes, kind of transition, right, and get geared up to maybe have somebody help out. And I didn't have an opportunity to do that. So, yeah, it was just an interesting time to have a baby, and it's been
Did you have a maternity leave?
I was working like part-time from home.
Right.
So, yeah, I was able to, you know, I worked from home for, you know, for the whole time.
Right.
So I was able to kind of somehow make that work. And again, it was kind of just, you know, not thinking, just
second nature,
just doing it. Yeah, there was just so much going on and so much to be done, and, you know, that it just, you know, I wanted to continue to be involved and just maintain, you know, what I could. So I did that for, you know, several months, working from home part-time.
Right. I want to get into a couple of phases that, you know, we all talked about over the past year. One we're still talking about more than others. There was a time when testing was extremely important, and the city played a role in that. Talk about how the city's role in not only educating people about getting tested, but also helping set up what's currently at Bristol Community College and other locations to get that testing done.
Sure, and I will say that testing is still really important.
Absolutely, yeah.
So people should really continue to be taking advantage of the testing. It's really important if you've been around somebody with COVID, even if you're vaccinated and have any symptoms, then you really should be continuing to get a test. So we were fortunate in a sense here to have that Stop the Spread initiative. That started way back in August, I believe, with our community organization STAR,
Health First in Seven Hills, and they were testing up until January. I think mid-January is when their contracts ended, and that's when CIC picked up in mid-January at the BCC site. And so testing, it's really important that we continue to get tested, and it's great we've had so many local options for people to, again, reduce that burden. It's totally free. It's still, free. And that's going to be extended through the end of June for the BCC CIC Health testing site.
I want to go back, Tess, to, when things got really concerning here early on, and then again during the second surge when numbers were really high. How difficult was it and frustrating was it to, get all these numbers of new cases and then, having to do the contract tracing? How difficult was it to try to close those loops as best you could?
Yeah, so we were handling the contact tracing through the fall. So the two, nurses and some team members in my office were handling all of the calls, all of the follow-up, and it got to be just too overwhelming because of the case counts. When you have 100 or more cases a day, and each one of those positive cases has 10 or more contacts that you have to follow, the load just becomes overwhelming. So fortunately for us and for many communities in Massachusetts, the state partnered with Partners in Health, and they had the Community Tracing Collaborative, the CTC, that was a resource for us. So we ended up sending, and we continue to send our cases to the CTC for them to handle the contact tracing because it was just too overwhelming for our small health department.
And now obviously we're shifting to vaccines.
Mm-hmm.
The city has its regional site at Bristol Community College. There's the, as we're recording this, there's still the max vaccination site now in Dartmouth. And we hope to see expansion there. What role do you see the city playing, continuing to expand that role as much as it can? Do you see any more city-sponsored sites maybe popping up as the more doses become available?
So because Fall River has been designated one of the 20 higher-risk communities, we will be receiving a vaccine allocation for health equity work. So making sure that people who kind of fall within these underserved or under-resourced groups have an easy access to receive the vaccine. So people of color, people who don't speak English or prefer not to speak English, people who have difficult time with transportation or don't have an opportunity to get to a site like the Dartmouth site, people with functional needs or disabilities, and then people who maybe are apprehensive of receiving care in a traditional healthcare setting, that we're going to try and do these targeted approaches for them. And so we'll be doing more localized clinics, more kind of pop-up clinics in a sense for those targeted populations. So we're currently working on that, identifying folks, working with community groups to get people identified so we can find out, where will be most comfortable for somebody to receive a vaccine, and we can deploy the Fall River, EMS group, the health department, public health nurses on site to administer and handle those vaccine efforts.
It is a little different than testing. Testing was more people taking the initiative in some ways. With vaccines, you want to cover more people. I mean, we would have loved to have had 88,000 people get tested in Fall River, right? But the vaccine is a whole different level. How is there a fear that you may be leaving some people out? I mean, because there's so many people that may be shut-ins, that may be in minority groups that you may not be reaching out to. How difficult is this task, I guess, is my question.
Yeah, I think for the homebound folks, that's kind of a separate initiative that we are also working on, and we've been coordinating with Bristol Elders, who's helping us to kind of devise a list of people who are homebound who meet the Mass Department of Public Health definition of homebound, who would then be eligible to receive a vaccine in their home. So that's a separate kind of group of people that we're trying to target and provide vaccines to. The other groups, like you mentioned, minority groups, we are
working with community partners and the diversity committee to try and faith-based organizations to try and reach people where they're comfortable, have somebody who's a trusted community member talk to them about getting the vaccine and trying to educate them that way. Not everybody has a comfort level with the government or healthcare facilities. So we really want to try and meet people where they're at and educate them that the vaccines are safe, that they're effective, and that we really all need to be vaccinated for us to kind of get through this pandemic. It's not an individual choosing to not get the vaccine. That impacts the community. So we all have to do our part, and that means getting vaccinated.
The regional site that the city is currently operating out of Bristol Community College, it's been about a couple of months now, I think, right?
Yeah.
As we record this. Are there any stories you can share? I know the mayor shared one at the State of the City address where there are people who hadn't gone out in probably a year, seniors, that were so pleased to get their vaccine. Is there something you can share that you may pop up in your mind?
Yeah, we've seen people crying at the vaccine site because they're just so overwhelmed that they're finally, feeling just this sense of relief that maybe they have an element of protection even after their first dose. We've seen elderly couples who are leaving, who are hugging as as they exit, or giving high fives, or calling family members as they're leaving. So it's really it's such a wonderful feeling to be able to provide people with an opportunity to get the vaccine. After so many months of feeling just seeing all these cases come through and the number of residents who have passed because of COVID, that the fact that we've been able to vaccinate, over 2,000 people has just really been rewarding, because we all want to get through this, and the vaccines are what's going to take us there.
Yeah. Final question. Let me just ask you. What have you learned through this in a year, and what do you expect, say, a year from now, public health-wise?
Well, hopefully public health-wise, there'll be more opportunities for local health departments to work together, more funding coming to local health departments. Obviously, as a public health professional, I feel as though public health has always kind of been put to the wayside. When things are going well, nobody needs to know about the public health department, because we're doing the work. We're doing our contact tracing and all of that. So I think that the benefit, in a sense, of this is that there may be more leverage from the state funding and federal funding that will funnel through to local health, and more opportunities for public health departments to pull from. So I think that's certainly a benefit in a sense. There's been a lot to learn from. I think no matter how long you've been in public health, this has been a major undertaking for any city and any health director. But I've been really fortunate to have support from the state and support from other health directors in the area and in the Commonwealth that I've kind of learned from and called and bounced ideas off of. So it's really been an interesting year, and I'm sure when we're kind of through it all, I'll be able to really take a look back and see what I've learned. But there's definitely just a lot. But all of it is, at the end of the day, it's kind of those public health basics, messaging and working with community partners and trying to get those folks who are maybe under-resourced opportunities. So just on a very large and longer scale.
Tess Curran, thank you for your time. I do appreciate it, and all the best moving forward. Thank you. I
Thank
appreciate
you, Keith.
it. And thank you for joining us today. I'm Keith Sebo. Have a great day.